Hello and welcome to the book launch event for Midwifing Mercy, Reimagining Birth Culture with Strategy and Sacred Purpose by Vicki Penwell. My name is Kristen Benoit and I'm the host for tonight's event. I'm the Director of Education for Mercy in Action College of Midwifery, and I serve on the board of directors and global leadership team for Mercy in Action's global nonprofit organization. Tonight, we have the privilege hearing from Vicki Penwell, Mercy in Action's founder and executive director and author of Midwifing Mercy, and Jenny Joseph, executive director and founder of Common Sense Childbirth. Jenny wrote the foreword for this book, and we're going to be hearing from both of them tonight. Hopefully, while you're waiting for this webinar to start, you had the chance to see some endorsements of this book, and we're going to look at a few more momentarily. First, we would like to acknowledge some people who helped in the process of launching this book. We want to say a thank you to Zoe Penwell, Vicki's granddaughter, for creating the graphics that you'll see tonight. And a big thank you to all of the many people who contributed to this book in some capacity, whether through editing, input, reviews, endorsements, and so forth. We also want to thank all of you for attending tonight, and a special thank you to our students, our graduates, preceptors, friends, and donors of Mercy in Action, and just a big thank you and welcome tonight. So I'm going to share a few more endorsements as we get started before I turn this over. And we are grateful to those who took the time to write these endorsements. From Jan Tritton, founder of Midwifery Today magazine, this is a brilliant, groundbreaking book. Though it was written for and about birth and midwifery, it is far-reaching with its sacred concepts that apply to any calling you may have. I am a reader, and it is one of the best books I've ever read. Do yourself and your loved ones a favor, read and share this book. Neil Shah, OB and assistant professor at Harvard Medical School. Every birth is a threshold, a moment when what we offer a woman either expands or diminishes her sense of what is possible. Midwifing Mercy is Vicki Penwell's nearly 50-year distillation of what it takes to get that right. It is a book about how culture shapes care and how care, when it is purposeful and dignified, saves lives. Shafia Monroe, since time immemorial, women have been called to midwifery from a place of purpose and service. As legislation and medicalization have shifted the profession away from its original calling, Vicki Penwell reminds us that midwifing with mercy keeps love at the center for the midwives who do the work and for the families they care for. In Midwifing Mercy, we are reminded never to lose sight of why we are called to this sacred work. And Robbie Davis Floyd, Vicki Penwell has developed and practiced sustainable models of birth that work to save thousands of lives and bring joy even in the worst of times. She is my cultural hero. So this entire book, Midwifing Mercy, is about how to get better outcomes in childbirth. So before we turn this over to our speakers, I want to show two slides that show how the nonprofit organizations that both Jenny and Vicki founded and continue to lead are getting superior outcomes in hard places. So this is from Jenny's organization, Common Sense. You can see the drastically lower rates of preterm births as compared to the state of Florida and the county where she is located. And Mercy in Action in the Philippines, in our work there, neonatal deaths in the country as a whole are significantly lower, as well as maternal deaths. Our outcomes are significantly better than the country outcomes as a whole. All right, I'm going to stop here, and with no further ado, I'm going to turn this over to our speakers, starting with Jenny, who will be reading the foreword from the book. Jenny, turn it over to you.
Thank you very much. All right. So I wrote this with love in my heart for Vicki and everything she stands for. Over a lifetime in this work, I've learned something simple. Some people talk about love, and some people build it into a way of care. There's a kind of care that looks ordinary from the outside, but it changes outcomes because it changes what people believe is possible for them. It changes whether a woman returns for her next visit, whether she tells the truth about what she's feeling, whether she calls when something feels wrong, whether she trusts her own instincts, and whether she trusts you with her fear. That is why this book matters. I've known Vicky Penwell long enough to recognize something rare. Her mercy is not a mood, it's a practice. It is structured, it is discipline. It's a consistent decision to treat women, families, and communities as precious, especially when the world around them has not. In these pages, you will meet a midwife who does not separate skill from spirit, or excellence from compassion, or outcomes from dignity. You will meet a system builder, someone who has served women and babies in fragile places and then done the harder thing, created a culture that can outlast any one person. That is the kind of leadership our birth world needs more of. We are living in a moment that lays bare a crisis decades in the making, one in which birth has become, for too many families, a place of fear instead of power, especially for those with the least protection inside the systems around them. Many people reading this already know that reality intimately. Some have lived it in their own bodies. Some have held the hand of a woman who was not listened to or respected. Some have watched the good care fail because the environment was rushed, dismissive, or unsafe. This book answers the question, is there another way? Not with a theory, but with lived and embodied practice. One of the things I value most about Vicky is that she understands what the modern world keeps trying to train out of us. Authentic relationships are not an extra, they're not optional. Relationship is protective and strategic. In my own work, I've always taught that how a person feels in your presence is not incidental. Rather, it is part of the intervention. When women feel seen, respected, and safe, they show up differently. Their bodies respond differently. Their families engage differently. Their decisions become clearer. Their courage returns. And care becomes something they can actually receive. Vicky and I have come to this truth from different roads and different settings, but we recognize each other because the principle is the same. We must build care that restores dignity. You will see that in her insistence on taking time on purpose. The world worships efficiency. Healthcare systems are measured by speed and revenue. Schedules are packed, people are processed, and then we act surprised when trust is thin and outcomes suffer. But Vicky challenges that lie with something braver: deliberate human attention, the willingness to spend time in the ways that make someone feel protected, the kind of presence that tells a woman without ever needing to say it, you are not a problem to solve, you are a person to honor. That kind of care is not sentimental, it is disciplined. It requires leadership, it requires formation, not just training. It requires a culture where everyone, from receptionist, student, medical assistant, midwife, and administrator, understands that we are not just delivering services, we are shaping an experience of safety. You will notice that Vicky is unafraid to speak plainly about character. In a time when people want shortcuts and credentials without cultivation, she reminds us that what seasoned birth workers already know. Who you are shows up in the room. It shows up in an emergency. It shows up when you are tired. It shows up in what you document, what you admit, what you hide, and how you repair. Technique matters, and integrity matters too. Accountability matters. Tenderness matters. Truth-telling matters. And importantly, Vicky does not write from a pedestal. She writes from the field, from the choices that cost something, from the kind of responsibility that forces you back to your purpose again and again. Her faith is not a slogan, it is a source. Whether you share her spiritual language or not, you will recognize its fruit: perseverance, humility, clarity, and a fierce devotion to life. So what should you expect as you read? Expect stories that carry both beauty and weight. Expect conviction and practical insight that does not betray the soul of the work. Expect to be challenged, especially if you've accepted what the system calls normal. And expect to be invited not just to admire what Vicky has built, but to examine what you are building in your own corner of birthwork. I am so proud to lend my voice here because I trust hers. I trust Vicky's commitment to excellence. I trust her devotion to women and families. I trust the integrity she brings to midwifery. And I trust that anyone who reads this book with an open heart will come away with something we all need right now: renewed courage to practice care that is both merciful and powerful. May these pages remind you that birth culture can change. May they remind you that systems can be rebuilt. May they remind you that your presence matters, because that is what a good book should do. It doesn't simply inspire you, it calls you back to that sacred purpose underneath it all.
Wow, Jenny, thank you so much. Thank you for writing those words. It
You.
really choked me up listening to you. Thank you. Thank you. And thank you for yeah, being on this journey together and being here tonight on the eve of the book launch that's coming out tomorrow. I guess Amazon actually shipped a few early, so there's a few
Yes.
people that already have theirs, but for most everybody, it'll come out tomorrow. So thank you for being here with me to talk about the book.
Absolutely, my pleasure. It's just such an honor. I'm so grateful, and I know we have a lot to talk about, so glad that you invited me. Thank you.
Oh, wow. Well, thank you to everybody. I feel like I should give so many shout outs. My actual acknowledgement in the book is pages and pages long. So uh, don't skip that part. I've found that it's really fun to read acknowledgments in books and not just skip them and you see a little insight. But yeah, I want to especially thank my son Ian for the cover. He's in the room tonight, and I love how the cover turned out. This was as Neil said, almost 50 years in the making,
Oh,
but the actual writing was about a year and a half of really, really, just knuckling down to do it and get the words on paper. And it's just snippets. It's certainly not any kind of a whole autobiography in any way. It's just snippets of stories. But the themes that you brought up in the foreword are the important things. The chapters are broken into parts that talk about a culture of serving with purpose, a culture of serving with creativity, and a culture of serving with generosity. So,
I'm so curious, Vicky, because, like you said, nearly 50 years. How did you even get to figure out how to lay out this book and to try to distill this wisdom that you have and you've shared so generously? How did you manage to put that into the book in the layout?
yeah, it took longer than I thought to actually get the layout together because
Yeah.
it isn't on a timeline. I mean, it jumps
Mhm.
all over. It jumps from country to country and decade
Mhm.
to decade and different teams and different patients and clients that I've worked with. So I followed that kind of theme of starting with looking at with purpose, with why we do the work. That's the very first chapter. Start with
Mhm.
why and
Mhm.
remembering why we do this in the first place. And um, you know, we've talked about how when you do this for this long, you have successes and you have failures. You have things that work and you have things that don't. But the basic why of my life has been consistent
Yes.
ever since the late 70s when I started, and I knew why. Um, and I think probably we've talked enough to know that I think your why is very similar to my why, because we
Mhm.
don't want to live in a world where women and babies die unnecessarily and of preventable causes. We don't
Mhm.
want to live in that world, so our choice is either check out or change it. Right? Am I?
Yeah.
Is that how you feel about it
Yeah.
too?
It is absolutely how I feel about it. And I think it's, what you've been able to help us sort of pull back in is the fact that, there's different regions of the world, different areas, different countries where it's not quite the same as it is in the United States. And yet it's the same application of these tenets and these ways of being that solve whatever the problem or issue is. So for me, I was called to midwifery when I was still living in England, born and raised in
Mm-hmm.
England. And, I was very drawn and I knew that's what I was going to pursue. Midwifery was the only thing I've ever done since I've been 19 years old, right?
Yeah,
But I
yeah.
came into a system of midwifery that, if you look at it from the broad, bigger picture, you could say back in 1979, there wasn't anything wrong with the midwifery that we were providing, and mostly through hospital care. It was, there were home births and birth center births, but the hospital is still the main staple, at least in Europe, And I grew into that as a professional, but thinking that was all there was, that was the only
Mm-hmm.
way for midwifery,
Mm-hmm.
right? But yet, inside of that very, if you think about it, reasonably safe system, right?
Mm-hmm.
In an industrialized nation with the resources and everything there to handle. I mean, in the 10 years that I worked in the hospital system in the UK, there was one maternal death. And I can recall to this day, I was a young midwife by then. I was already qualified and working, but the entire hospital, and I remember it because, like, going across to the cafeteria for lunch, the cafeteria was a buzz and a gog, and there were just people just in shock. Like, we lost a mother. It was unheard
Mm-hmm.
of,
Mm-hmm.
right?
Mm-hmm.
And in losing that
Mm-hmm.
woman,
Yes.
it was the C-section and the hemorrhage. They couldn't staunch the hemorrhage post delivery, and they lost the mother. And it was almost like we were gonna, shall we shut the hospital down? Should we? Like, it was that
Mm-hmm.
much. It was so very unusual that a
Mm-hmm.
mother had been lost for a preventable reason.
Right.
So
Right.
fast forward, and I come to the United States without any clue. I didn't do any research. I just fell in love and came to marry my sweetheart, and here I am. But what happened was then I had to understand midwifery in different contexts,
Yes.
right? The historical part of the midwifery story in the United States, the ancestral part, the indigenous midwives, the enslaved midwives, all of these different communities, the immigrant communities brought their midwives with them, right? Like, so midwifery showed up in the United States differently to how it does around the rest of the world, right? Whether it's in a developed nation or a developing nation. And so
Right.
I feel you've done with the book is you've helped us pull all that together, because underlying all of it, wherever there's harm, harm can be mitigated, death can be
Yes.
prevented by these same simple tenets and concepts that you've outlined in this book. So although I was in England for those many years, we didn't have to use them in that sense. But yet, at the core of it was always the centering of mother baby family, the
Mm-hmm.
dignity of mother baby. And because it was normalized, no one had a big thing to figure out about, oh, midwifery, is it for me? It was just what you did, right?
Right.
But those skills of just attending in a normal, straightforward way and holding as many people as we could central every time without fail helped me as I transitioned to the American approach, realizing what was really deeply behind so much of these outcomes, these poor outcomes, and
Mm-hmm.
recognizing that it was just simply a matter of applying what I already knew. It wasn't in anybody's textbook until now, but it was part of how we practiced. And, the number one thing we did when we stood up our nonprofit organization in 1997 was no one's going to be turned away, because
Yes.
everybody must have
Absolutely.
unimpeded access to this level of care.
Yes, absolutely. And I love that we're the same age, basically. We
Yes, we are.
started and we both started so early.
Yep.
I started right. I married Scott right before I turned 20. So I was a teenage bride and then I went straight into studying midwifery
Yep.
um in my when I turned 20. So yeah, we started out and it's interesting because you talk about your journey from England to the United States and all that, man. And of course
Yeah.
mine went the other way, I was born and raised in America, but I do remember in midwifery training where you're right, it was such a rare thing to ever lose a mother. And then I was invited in the late 80s to go over and help first with in the country of Laos and then the Philippines, and realized that, oh, it's so normal over here. Like, you would just run into it on any time you went in a hospital. There was like somebody just died or somebody is, I remember meeting a woman in a bed who actually was sitting up talking to us, but her kidneys had shut down after a postpartum hemorrhage and there was no dialysis. This was like, 40 some years ago, 30, 35 years ago. And just knowing that she wasn't going to survive, it was just a very heavy thing. So I had been working then in Asia for a couple of decades when I started looking back across the Pacific and saying, wait a minute, the United States is not doing good. It's still, I mean, it's different, but it's the same issues, and that the same answers are going to work in both places. And that is to have this care that is not trying to be either safe or respectful, but that's being safe and respectful. And that like you say, centering the person, the dignity, the human aspect, but also having these excellent skills to prevent the hemorrhage or to resuscitate the baby or to prevent and treat early the preeclampsia, eclampsia, and things like this. So it's never been an and or to me. You can't be too medical or you can't be too hands off. It depends what's unfolding, right?
Right.
It's prevention first. And I want to talk a little bit about prevention because, Jenny, that was kind of how we bonded when we first met. And of course, we had talked and knew of each other for a long time before we actually met in person for the first time. So I remember hugging you on site like we were old friends
Right.
when we finally met at a conference one time. But I was asked if I would read a little section from the book. So I'm going to read something that might surprise people that's in a book on midwifery because it's about caring for homeless people. I'm going to start with this story. And the book has quite a lot of little snippets like that where I'll take something from somewhere else and apply the principles back to midwifery. So I'm going to talk a little bit about something that's often overlooked in healthcare, and that is lavish hospitality. It seems to be viewed as a luxury or only for rich people who can afford boutique care or those kind of things, but how it can have a life-saving impact. So the section I'm going to read is in a section called The Time We Waste. And I'm going to tell a story about King's Table. And then we'll lead into when we met. And then I want to hear you describe again. I'm not going to read the part where I describe what I learned from you. I'm gonna let you. Okay. In the mid 1990s, my husband and I took the lead in helping our church set up a ministry to feed homeless people in the border town of El Paso, Texas. King's Table was a weekly outreach that we set up to turn the way that charity was delivered upside down. Instead of a food line or potluck style serving, we filled a room with round tables covered in lovely tablecloths to create a cafe vibe. And we served each guest as if they were in a fine dining restaurant. One server would deliver individual drinks to a table, greeting each diner, and another would bring the rolls, serving each person from the bread basket as they circled the tables. Another would serve the main dish. Still another would stop by after the meal with dessert. Between courses, servers were encouraged to sit down at the tables and engage in conversations with the guests. We could have served everyone more quickly with trays or by lining them up, but speed wasn't the point. Before each meal, we gathered our volunteers to remind them of our true goal, to create as many meaningful personal connections as possible with each guest. We aimed for at least 6 different team members to interact with and serve each person in some small way. We referred to these moments as touch points, each one an opportunity to affirm dignity through a simple human connection. We wanted each person who attended this King's Table meal to walk away feeling valued, honored, and loved. We were trying to represent well the hands and feet of Christ. Since many of the people who came were unhoused and living on the streets, they rarely experienced people going out of their way to spend time with them. Even fewer had the chance to linger over a hot meal, served with such meticulous attention to detail. Our deliberate inefficiency was the very strategy that made it powerful as an expression of love and welcome. Invariably, this deliberate inefficiency would drive some volunteers crazy.
Mm-hmm.
Often a new volunteer who had missed the pre-meal team gathering, where we shared the why behind our methods, would approach me with their ideas to improve our efficiency. I became accustomed to being told that we shouldn't waste so much time and that we should instead line everyone up to spoon food onto their plates as they walk down a row of servers. I would always respond gently by saying, yes, your idea would be more efficient. I agree. But efficiency isn't our goal. We are not just serving food. We're here to serve love. This gives you a background and a reference point for how our teams around the world offer birth care. In the same King's Table spirit, our midwives are encouraged to take time with each person who walks through our doors, creating touch points of genuine connection and kindness. We want our clinic to feel less like a medical office and more like walking into the home of a friend, where people are known by name, cared for with tenderness, and never rushed. Just as we can set a literal table and serve each guest with dignity, we use that hospitality model in our midwifery. Imagine my surprise and delight when I was talking to Jenny Joseph of Common Sense Childbirth in the early days of our friendship and discovered that she uses basically the same strategy in her Florida clinics. I remember smiling to myself as Jenny was sharing her model and her outcomes, thinking, this is the King's Table model. Blessed inefficiency at its best. So, Jenny, I want you to talk about that purposeful inefficiency that sets the stage for the improved outcomes that you are seeing in Florida compared to the state you're in, and that we are seeing in the Philippines in compared to the nationwide statistics that we're in. How does being purposely inefficient and flipping the script on its head
Yes.
change things in your view?
Exactly. It really is, I think, on an individual level, it is just deciding that you're just going to flip some tables or you're just going to flip the script, as you'll say, or flip the classroom. But it's also on a collective or even an organizational level buying in. Like you pointed out, the volunteers took some umbrage, like, ooh, what are we doing here? We're not doing it right. Like there's standard ways that we have become accustomed to or even expect. When you go a little bit outside of that line, coloring outside of those lines, folk take sometimes more time being upset or worried about that than actually thinking through
Right.
what's their why and how
Yeah.
might they be able to do something similar. Because it's not for everyone, but I will agree with you, Vicky, the entire length of time, or even to this day, I still have the naysayers like, well, you just can't do that. Well, you
Mm-hmm.
shouldn't be,
Mm-hmm.
they should be, there's all of this
Wasting time,
judgment,
right?
right, and the blame. So for us, we really, that was, and how we formed the nonprofit, that was the original mission. No one turned away. At the time, we were talking about just clinics, but it's expanded over these years. We'll be 30 years old next year. And so over the course of those years of developing this model, we realized really our inefficiency is that we share out the midwifery role through the entire staff. It's not
Yes.
efficient when they put it
Yes.
together, but it sounds like it ought to be because there's,
Mm-hmm.
the main thing that we have 5 stations in our model at the clinics, and that station one is reception because it
Mm-hmm.
begins right there. Our door, and as soon as if we're serving clients and the clinic is open, the door is propped open. It's not a matter of you have to ring a bell or turn the doorknob. It's open from the hallway. You can just come out of the elevator and see our doors open, the only open door in the entire corridor. So you
Nice.
come into reception and you know immediately that you are welcomed. The receptionist training is you better look up and say good morning, nod your head, wave if
Yes.
you're on the phone, acknowledge We don't have any glass. We don't have any sliding, any barriers. We don't have, from the beginning, we haven't even started a medical visit or a midwifery visit, but you are going to get, as you stand in that reception, that you're welcome.
Hey, you're
And
welcome. Yeah.
there's an inefficiency in that too, because oh my gosh, she's going to slow up the line. And, because we have volume clinics, we've been able to get this down to a science. We can move patients in a clinic day like nobody's business. But here's the difference in our moving them through. Our system allows that so-called inefficiency to give them an experience from the reception on. The waiting room is an experience. It's not just sitting and waiting. The
Right.
nurses or the medical assistant station is another experience. You have time with them one-on-one. The doulas and the resource supporters are going to have some time with you one-on-one. By the time you hit the exam room with the midwife or the provider, you've already had your hour. You have been around the
Yeah.
whole space. Your kids have had time to
Yeah.
play.
Feeling
Your
loved.
family have been
Yeah.
encouraged to join in, ask questions. By the time you get to the midwifery piece, which is actually one of the smaller pieces of this whole experience,
Hmm.
you are clear that there's some people here that want to know, want to support, want to stand with you, are in this gap with you, and
Yes.
that there's no rushing, just like the meals that you served, just like the placement of the volunteers to sit and integrate and talk.
Hmm.
These things are purposefully built into a model. And so, what I'm saying is not just from the point of view of these functional pieces, but from the personal, interpersonal, even. How are we going to just allow ourselves to be outside of these boxes in order to get the results? And you see how spectacular the results are. Those graphs cannot be disputed,
Yeah.
right?
No, that's,
The
yeah.
outcomes are, we're talking about lives versus
Yeah.
just
Saved.
statistics,
Yes.
right?
Yes.
So it's
Right.
an interesting thing to bring about change through, oh, there's actually nothing wrong here. Because that is the
Hmm.
agreement we have in the United States. There's these pesky disparities that keep showing up, messing up our statistics. But if only the women would behave, or if only they would do X or Y and save their own lives, we wouldn't have this problem. So that sort of then is really precluded by an agreement, a tacit agreement. There's actually nothing wrong if these folk would just behave, right? If they would just do some different
Do
things.
everything
Right.
right.
And
Yes,
so in
exactly.
areas where there really is something wrong, such as developing nations, under-resourced nations, right? Even though there's a different reason for the harms and these outcomes, they are still solved the exact same way.
Hmm. Hmm. Yeah. And I like the way when I met you, the thing that stood out to you, and it still does to me today, is that there's no limit on what we can accomplish if we don't care who gets the credit. And when you told me I'm happy if they bond to the receptionist or the doula or the person that works in the lab, it doesn't matter that they don't have to fall in love with their midwife. They just has to bond to someone here that's part of this
Right.
team. And I have really always tried to train that into people. Don't fall for it's kind of heady and it feels good when you're a young midwife if someone just wants you, but it's
Hmm.
really not, it's not healthy and it isn't sustainable. But a
Certainly
team,
not.
now a team, if people come in
Mhm.
and as you said, we want to make sure they bond to their baby, that they
Yes,
bond to their own family support
that's
system.
right.
But within what we offer as midwives, it doesn't have to all fall on the one professional.
That's right.
It can be a team effort. And I also wanted to share in the Philippines, we've been doing something for years that's kind of fun. Is just having the waiting, and you talked about that, the
Hmm.
waiting time be productive. It's not
Absolutely.
just mindless, like watch TV
Hmm.
or thumb through an old magazine, but it's a
Hmm.
chance for education. That's where a lot of childbirth education
Oh,
happens,
absolutely.
is in the waiting room. And
Yeah.
that's where the relationships are built before they ever even get back to the exam room to meet the midwife. And that's going to hold them and make them feel secure uh,
Well, it builds
with
community
all of
too.
your care.
It
Yeah,
it helps folk to realize I've got other folk in the same boat, but they live around the corner. Like we see the relationships spread out past the clinic and into the
right,
community. The
right.
word of mouth is our marketing. We
Yeah,
barely have
ours
done
too.
any marketing this whole time,
Us
Vicky.
too.
everybody's coming in with so and so sent me. They said, if I get here,
Yeah,
you'll help me. And then
that's
when we say,
right.
yes, that's true, there's tears because they're like, I've been everywhere. I've tried so hard. I've done, we have so many third trimester mommies still showing up because for all the resources, for all of the supposed, supports that are in their community, how come you can't get access? Oh, big problem. Which is why
Yeah.
something as simple as no one turned away gives us a starting point, gives us an
Yes.
opportunity to
Yes.
triage any and everybody. No one will touch you with a 10-foot pole in our area if you're a whole 20 weeks pregnant. Oh my gosh. Right now, we're going to
Yeah.
break
Late
down
to
and tell you how
care,
bad
right?
you are and how you put your baby at risk. And we can't help you because now it's too late. A lot of this stuff is just bureaucratic and I feel
It's hard
ridiculous
to get in the
cruelty.
door. Yeah, that's right.
Cruel.
Let's talk about that. So I started in Fairbanks, Alaska, back when I was very, very young, and had a first of private practice, which I quickly decided that the nonprofit world was going to be my world and my people, and changed it all into a nonprofit. But was
Mhm.
there for 12 years before going over to Southeast Asia. And we used to call it open access. I know you have coined the term easy access, but
Right.
the concept, let's talk about that, is that
Something.
whatever else we do, one, we're looking for people early. We're
Yeah,
not telling them wait till a date when you're 12 weeks, you could start. We used to do how to grow a healthy baby classes, and we would tell people to come when they were just thinking about getting pregnant
that's right.
sometime this year. And then
Hmm.
we would say, they'd go, well, I just got, I'm not even sure. I'm like, come, we'll start. We'll start because the first 1,000 days, as we know now, starts
Yeah.
with conception and is the most important time in a person's
Mhm.
life. But then the prenatal care, even in a model where you have to sustain yourself with payments, that first visit is always just, there is no money exchanged for being seen the first time and
That's right.
sorting out what you need.
Exactly.
And when I discovered that about you, that you had done this, you were doing and are doing the same thing we had done in
Hmm.
Alaska, and then we, of course, are doing in the Philippines because we work with people in abject poverty. But then it
Hmm.
works again. And then when Rose started we had a model birth center in Boise for 5 years, as you know, you visited
Hmm.
here. It was the
Yeah.
same way. That first time in the door,
Yes.
we're going to see you. We're going to welcome you. We're going to maybe for sure give you a drink, maybe feed you. And then we're going to do the history. We're going to do the exam.
Yes.
We're going to find out what you need. And then we'll sort out, are you high risk? Do we need to help you
Right.
get on Medicaid and see a doctor? Are you low risk? Would you like to deliver here? And then let's talk about how you're going to pay for the rest of what's coming, but it's not ever a barrier
That's
at the
right.
door. And that's very unique, Jenny. I don't meet too many people. And you may know more in America because, again,
Mhm.
I'm only here sometime. I mostly live overseas.
Mhm.
But even overseas, we have found that in the Philippines, even though so many people are so desperately poor, a lot of the midwife clinics, the freestanding clinics, even though we have a scheme now for the government to help with health insurance, people want to add something on top of that. Like, but
Yes.
you just have to pay, even if it's only 1,000 pesos or something. It's more than people can afford. So
Hmm.
yeah, speak to that concept of just
Yeah.
that easy access concept and how you feel that shifts
Right.
the outcomes in the end.
I think it expedites. We were talking about inefficiency just now, but this one is an expediting kind of factor. And by that, I mean that the family can move faster to trust. They can move,
Mm-hmm. Yeah.
with a little bit more sense of less fear and trepidation that actually it might
Mm,
be okay. These people
yeah.
might for real be different. I never expected this. So the expediting is that rather than wait till we hit the, second trimester, middle of the pregnancy, oh, let me take a breath. Maybe it's going to be okay, right?
Yeah.
We've
You can
already mitigated so much of the
establish that.
underlying fears and the re-traumatizations and the PTSDs that I'm absolutely convinced, and I haven't got a scientific piece of fact that I can prove, but I believe strongly, because our consistent outcomes have told us so, that this expedites that chance of the physiological outcome that we're looking for.
Mm-hmm.
How is
Uh-huh.
it that a cervix is going to lock tight because your first visit, your second, and maybe your third visit, you absolutely got the same consistent level of quality and care that you got the day one from the day one. And you can
Mm-hmm.
depend on that. You can count on that. You can trust that. So much so that you will tell your neighbor, get over there. Go now.
Wow. Okay, I like this. I never put together the fact that the inefficiency of making people feel safe and welcomed, the hospitality piece, which love always takes time, right? You can't rush making someone feel safe with you. But what you're saying, and I believe this is true, is that that does expedite their feeling of feeling
Yes.
safe. The fact that you were willing to waste time on them is what makes them feel safe
Right.
faster. So
Right.
that is very cool thought that the slowing down
Absolutely.
makes us speed it up, trust. And once people trust you, they're more likely to call you in the middle of the night if they're starting to feel or those early contractions, which we can often shut down with just telling them lay down on your side and drink water and we'll come right
Hmm.
over and check on you and all these
Hmm.
things will sometimes not even, go into preterm
Yes,
labor, or they're going to tell you at the very first sign of a headache, not when they already have full blown,
that's right.
eclampsia, things like that. So the extra time, the extra love, the extra safety is going to make them move quicker into the outcomes
They
that
can
we're looking
settle.
for is, yeah, they can settle and they can feel safe. Yeah.
They can, yeah.
Yeah.
And you're right. I think, we not only offer this at the actual physical visit in the office, this is a 24/7 thing. The minute you make a phone call or you get there for that first visit, you're given the 24-hour number. Whether you stay with us,
Mm-hmm.
it doesn't
Mm-hmm.
matter where you end
Yeah.
up. People will call us
Right.
who have been in maternal fetal medicine and are, like, I'm in labor now, and they giving us this feedback as if we're the ones. And one of the things that in the early days, another reason the naysayers were like, oh no, you can't do that because, who's going to deliver the baby? And there's no continuity in the mother's. Honestly, seriously, our C-section rates are like ridiculously low in the very
Mm-hmm.
hospitals where
Mm-hmm.
they're sky high all day and have been for decades, right? The
Yeah.
1 in 3 that has been the American story for a cesarean section, I mean, I would say at least the last 20 years, we don't even know what that is. We have no idea because these mothers from all walks of life across all demographics walk into these same hospitals and come out with their baby a couple of days later, smiling, breastfeeding, and no scar in their belly.
Right.
What
Right. So
again, we're
that
not even
is
there.
changing
We're not
outcomes.
even
Right.
there. We're not
Right.
the
You empowered.
continuity that we think is like so key
Yeah.
is actually not the
It,
case. In fact, people are empowered, which is why at the end of these experiences, we find they get to empowerment really quick. If they feel that they have autonomy and self-determination,
mm-hmm.
they
Mm-hmm.
can fend for themselves. You could put them in any
Yeah.
environment. It's not
They
about you have
found
to
a
be in your own
safe place
bedroom.
early. Yeah, they
Yeah.
found the safe place early.
Yes.
And the continuity is it's there because
It
they
is.
have your number
They have
and
access.
because they feel like they're cheering for me, and
Yes.
even if they're high risk
Yeah.
and can't. And we have the same kind of thing now in the Philippines. In the past, we had quite a lot of our the patients that would come were oftentimes rejected from another hospital first, and they would come and find us because they were turned away for lack of money.
Hmm.
And so you never even met people sometimes until they were in labor, and so you've got to move very very quickly to establish
That's
that
right.
trust. But it is possible. It's easier if you can lay it down early, but it is
Hmm.
possible at any point with that loving presence. And that brings me back to the concept of hospitality. There is a concept that I learned about while I was writing this book called homefulness,
Mm.
and it's sometimes used in circles where people are talking about community in a way that your very presence, it's not a place, it's not somewhere that you think about, I invite someone into my home or my clinic. It's you, it's your body, it's your
That's right.
soft smile, it's your tender touch, it's your demeanor that makes someone feel at home in your presence. And that's a really incredibly, beautiful concept, and does, I believe, all of this leads to better outcomes. But now
Absolutely
we're
does.
we're actually taking care of now some very young teenage girls in the Philippines who are living in a home for abused children,
Mm,
and they are considered outside of our scope of practice. But we do everything but the actual delivery,
right.
and support them afterwards. And I mean, I hear what you're saying, that we have to
Hmm.
rethink sometimes the way we can provide midwifery. It's not just about the home birth for people
Right.
that they could be very high risk and benefit greatly from the spirit of midwifery care.
I agree. I so agree. I found that, telehealth has been our recent best friend. We've reached people where we couldn't have reached them before because of telehealth. We really just call it telesupport, but folk aren't
Mm,
yet accustomed to that word. But
uh-huh.
we found that you can extend and be the same way through the phone. People don't even want to
Yeah.
be on the Zoom and the video call. They're not interested in that. They want the phone call. They've all got phones at work, even if they're in these areas where there's not good broadband, bandwidth and so on. And these are just continuing to keep rethinking, is there any other way we can think outside this box and
Right.
challenging ourselves and each other to find those ways because we want to
Right.
scale these models, right? And that is what you said
Right.
earlier, there's not many that have
Hmm.
really established wherever they are in the world to continue with this model, the work that you've outlined in your book, the way you've helped us sort of break it down so systematically it can be implemented, right? That it's not as overwhelming and as scary as folk might think it is. It may be a
Hmm.
little different,
Hmm.
but if you
Hmm.
think about the
Yeah.
benefit on the other end, what's at stake
Right.
for not using it, right?
Right, right.
And
And that's what we just keep coming back to, is how do
yes,
we improve outcomes for mothers, babies, and
right,
families, and by extension, entire communities, right?
right,
Yeah.
exactly.
And if we keep our focus on that, then it does guide our decisions about,
Yeah.
choices that we're going to be making along the way. So
Your principles that you've outlined, your sections, they just name it and give us all the like here's the template.
yeah, yeah. And it's funny how you hear about all the problems in healthcare, but you rarely hear anyone bringing up that one of the solutions is something like the character of the provider.
Right.
And yet we know that that really matters. Very few people would think of words like hospitality or love or
Mm-hmm.
genuine caring if they were making this is how we're going to reduce maternal and
That's
infant
right.
mortality. And yet, um, midwives have this secret that we do know, that relationships are important, right?
That's right.
Relationships are important, and yet, as you said in your forward, there's so much pressure all the time on us to move away from that, and to
Yeah.
yeah, yeah. It's important. It's
Well,
important.
I think for millennia, midwives have been the model example of how patient-centered, person-centered care can be delivered. And
Mm-hmm.
midwives, along with that concept, have found a way every time there wasn't a way, they figured it out.
Mm-hmm. Mm-hmm. Yeah.
You
And
know,
that's the thing. We are infinitely creative.
aren't we?
So when people do say, well, I don't know how I could afford to do that, or I don't know how that would work, sometimes I just think we need to unlock our creativity,
That's
because we
right.
all had it as children. I have a whole section on creativity, and I actually talk about there's not a child alive that doesn't think they're creative. They get out their crayons and their
Mm,
markers and
right.
their sticker, glitter, glue,
Mhm.
but when we grow up, we forget that we're creative. I'm always saying to midwives, like, I believe we have the creativity to get
Absolutely.
around that. If
Yes,
it's a barrier of time, money, distance, we can be creative enough to figure out a way to
that's right.
dismantle those barriers, if we, and especially if we put our heads together, right?
I
especially
think
if we work
collectively, as we
together.
lift each other up and we share with each other how to support each other, because the same level of investment into our own centering is the healthiest road to make this sustainable, right? When
Yes,
we center
yes.
the provider, when we center the students, when we center the allies, and help them understand how, in taking care of them and them taking care of themselves, we
Mm-hmm.
can all of
Mm-hmm.
us be even more creative, but even more compassionate. We can find a little
Yes,
extra to put out in the world like that. And I think that, again, the key here is that when we start with ourselves, we've got an abundance of love. There's no shortage.
yes, yes,
There's
right,
an
exactly.
abundance of care and compassion. There's an abundance. We just have to tap into it.
We have
Because
to
when we
tap
put,
into it,
Mhm.
yeah, and
Yeah,
have the mindset that it's not a pie with limited slices. It
right.
is, it is limitless. Well, lest the listeners listening in on the conversation think that it's all about these kind of, concepts that are kind of ethereal out there. The whole middle part of the book is very practical on using
Practical.
frameworks
Hmm.
and using things that already exist. And I just
Yeah.
have to give a shout out here for the International Childbirth Initiative, which is a part of the framework of mother friendly, baby friendly care. It
Hmm.
also centers the provider. And
That's
so
right.
we have come up with a lot of creative ways to make our lives better as the providers. And this is the mystery to me, that we can pour ourselves out and give of ourselves, selflessly, that we can love without needing to have boundaries on it, that we can be hospitable, that we can be generous, and that we can still thrive.
That's
And a
right.
lot of that is mindset, because what we know from modern psychology now is that a lot of things like generosity are, we are wired to love, to help other people and to
Mhm.
give, and it benefits not just the recipient but also the giver, but only if our minds are in the right place and we understand what's happening, that it isn't a limited pie,
Mhm.
that we can also build around us a network that will support us,
Mhm.
and we can do midwifery smarter so we don't burn ourselves out. And I
That's right.
think that's what a lot of the frameworks, mindsets, and innovations and strategic thinking is kind of like core, also to
Mhm.
the book I wanted to write and get out into the world. So, well, Jenny, it's been wonderful. I know we're almost out of time. Kristen said to tap her and bring her back in the room when we had about 10 minutes left, and we went over a little bit. It's been so fun to just sit here and be
Yes.
talking to you about all these
Yes.
things, um, and let everyone listen in. So, thank you. Thank you for being here. Thank
You.
you for writing such a beautiful forward.
Thank you for
And
writing such a beautiful book. Such a necessary book.
oh, thank you, Jenny.
Mhm.
Kristen, what's next?
Thank you so much. Thank you, both Vicky and Jenny. I just love hearing from both of your wisdom and just how our attitudes and our character, how hospitality, generosity, all of these things can shift birth culture and improve outcomes. And all of these topics are what's in the book, this reimagining birth culture, the subtitle of the book, which I have a copy of right here. And I love that because that's exactly what both of you talked about, is just how we can reimagine birth culture and improve outcomes. So I am excited to say that if you ordered this book, it releases tomorrow. I'm going to pull up a screen share. If you pre-ordered it or if you ordered it tonight, it will ship tomorrow on the release date. And I'm going to bring up here all the places that you can order it if you would like to do so. It's available in a hard copy, printed version, basically anywhere that books are sold. Ebooks are available only through Amazon. We'd love to just ask that you read it, buy a copy, read it, and leave a review on any or all of these sites. And I also want to say that all of the proceeds from the sale of this book benefit our work of maternal child health globally. Vicki is not personally benefiting from the sale. It's all going to Mercy in Action. And like I said before, I'm really excited about this book releasing. And I had the privilege of having a front row seat, getting to help just in some of the discussions and things like
Yes,
that. And
thank
such
you.
such a privilege. And every time I read the words in the book, I'm just deeply inspired about the kind of midwife, the kind of person that I want to be. So I really thank everybody for attending. Thank you so much to Jenny and Vicki. And yes, hope everyone has a wonderful rest of your evening.
Thank
Thank
you.
you.
Blessings.
Bye.